What if I told you that the single most dangerous thing happening inside your body right now has absolutely nothing to do with your heart, your lungs, or even your brain? What if the real silent killer sneaking up on millions of people over the age of 70 is something most doctors never even mention during a routine checkup? What if the answer to fixing it required nothing more than one simple movement that you could do right now, sitting in your chair, wearing your pajamas, without breaking a sweat or spending a single dollar? I know that sounds almost too good to be true. I know you have probably heard promises like that before. But stay with me tonight, because what I am about to share with you comes directly from years of surgical experience, from operating rooms, from watching patients suffer from a condition that was entirely preventable, and from one remarkable discovery that changed the way I think about aging, health, and the human body forever. Let me start by painting a picture for you. Imagine waking up one morning and your feet feel like 2 blocks of ice. You pull on your thickest socks, you wrap yourself in a blanket, but the cold never really goes away. Then you notice that your ankles look a little puffy. Maybe your calves feel tight and heavy by the afternoon. You think to yourself, well, I am getting older. This is just what happens. You accept it the way you accept gray hair and reading glasses. You call it normal. But here's the truth that I need you to hear tonight, and I need you to really let it sink in. That coldness in your feet is not normal aging. That swelling in your ankles is not just something to live with. That heaviness in your legs is your body sending you a desperate, urgent signal that something is going wrong deep inside your circulatory system. And if you ignore it long enough, that signal can turn into something far more serious than discomfort. Poor leg circulation after the age of 70 is one of the most underdiagnosed and undertreated conditions affecting older adults today. We live in a world where everyone is talking about cholesterol and blood pressure and blood sugar, and those things matter enormously. Do not get me wrong. But the health of your leg veins and arteries, the ability of your blood to travel efficiently from your heart to all the way down to your toes and back up again, that conversation is not happening nearly enough. And people are paying the price for that silence with their quality of life, with their independence, and in the most serious cases, with their lives. Here is what happens inside your legs as you age. Your veins, which are responsible for carrying blood back up to your heart against the force of gravity, contain a series of tiny valves. Think of these valves like little doors that open and close rhythmically to keep your blood moving in the right direction. When you are young and active, these valves are strong and responsive. But as you move through your 60s and into your 70s, several things start to work against them. First, the walls of your veins naturally lose some of their elasticity. They become slightly less flexible, slightly less efficient at squeezing blood upward. Second, many people become less active as they age, which means the natural pumping mechanism that your calf muscles provide when you walk and move is no longer doing its job as effectively. And third, hormonal changes, inflammation, and decades of gravity all take a cumulative toll on those small but vital valves. When the valves weaken, blood starts to pool in the lower legs. It collects in the ankles and feet instead of circulating properly. This pooling creates pressure. That pressure causes fluid to leak out of the vessels into the surrounding tissue, which is why you see swelling. It also means that the tissues in your feet and lower legs are not receiving the fresh, oxygen-rich blood they need to stay healthy and repair themselves. And here is where it gets dangerous. When your circulation is poor, small wounds on your feet and ankles heal much more slowly, sometimes not at all. The nerves in your feet, starved of proper blood flow, begin to behave erratically, which is why many people experience tingling, numbness, or that burning sensation that keeps them awake at night. And in the most severe cases, blood that is pooling and moving slowly becomes a prime candidate for clotting, which can lead to deep vein thrombosis. And if a clot travels to the lungs, it becomes a pulmonary embolism, which is life-threatening. I want you to understand that I am not telling you this to frighten you. I am telling you this because knowledge is the most powerful tool you have. And I am telling you this because there is something you can do about it, something specific, something that research and clinical experience have shown to be remarkably effective at improving circulation in the legs of people over 70. Something that does not require a prescription, a gym membership, or a single piece of expensive equipment. Before I reveal what that exercise is, I want to take a moment to explain why so many traditional approaches to poor leg circulation fall short for older adults. Most doctors, when they recognize the problem at all, will recommend walking. And walking is wonderful. Walking is genuinely one of the best things you can do for your overall health. But here is the challenge. For someone over 70 who already has significant circulation problems, who already experiences pain or cramping in the legs when they try to walk, whose balance may be compromised, and whose joints may be struggling with arthritis, telling them to just walk more is not always practical. In fact, for many of my patients, it felt like being told to just fly when they did not have wings. Compression stockings are another common recommendation. They help by providing external pressure that assists the veins in pushing blood upward. But many older adults find them incredibly difficult to put on and take off. The material is stiff and tight by design. For someone with limited hand strength or mobility issues, wrestling with compression stockings every morning can be genuinely distressing. And while they provide some relief, they are addressing the symptom rather than strengthening the underlying mechanism. Medications are sometimes prescribed as well. Blood thinners for those at risk of clotting, medications to manage swelling, various supplements that promise to support vascular health. These all have their place, and I would never suggest abandoning treatment that your physician has prescribed. But medication alone, without addressing the physical mechanics of circulation, is like patching a roof without fixing the leak. What I found, through years of observing post-surgical patients and studying rehabilitation outcomes in older adults, is that the single most effective intervention for poor leg circulation in people over 70 is something called ankle pumping. Now, I know, the name sounds almost embarrassingly simple. And maybe you have heard of it before. Maybe someone mentioned it to you once in passing and you thought, that cannot really make a difference. But let me tell you exactly what is happening in your body when you do this movement correctly and consistently, and I promise you the science will change your mind. Your calf muscles are often described as your second heart. That phrase might sound poetic, but it is anatomically accurate. When your calf muscles contract, they squeeze the deep veins in your legs and physically push blood upward toward your heart. This is why walking is so good for circulation. Every step you take contracts those calf muscles. Every contraction is a pump. Now here is the beautiful thing about ankle pumping. It activates exactly this mechanism without requiring you to stand, without requiring you to put weight on painful joints, and without requiring significant energy or effort. Here is how you do it. You can do this right now, wherever you are sitting. Sit comfortably with your feet flat on the floor. Now, keeping your heels on the ground, slowly lift the front of your feet, your toes, and the ball of your foot upward toward your shins. Hold that position for just a moment. Then slowly lower your feet back down and press your toes gently toward the floor, pointing them slightly downward. Then lift again. The motion is a gentle, rhythmic seesaw. Toes up, toes down, up and down, up and down. Each cycle should take about 3 to 4 seconds. Not rushed, not aggressive, smooth and deliberate. What is happening inside your legs as you do this is genuinely remarkable. Each time you pull your toes upward, your calf muscles contract powerfully, squeezing those deep veins and driving blood upward against gravity. Each time you point your toes downward, the muscles relax, allowing fresh blood to flow in from the arteries below. You are creating a rhythmic pumping action that directly mimics the circulatory benefit of walking. You are manually operating that second heart we talked about, and you are doing it from the comfort of your chair. Studies looking at immobile patients, including post-surgical patients who cannot yet get out of bed, have shown that consistent ankle pumping dramatically reduces the risk of blood clots forming in the legs. In rehabilitation settings, it has been shown to improve blood flow velocity in the deep veins of the calf within minutes of beginning the exercise. For older adults using ankle pumping as a daily practice, clinical observations have noted reductions in ankle swelling, improvements in skin temperature in the feet indicating better blood flow, decreases in nighttime leg cramping, and patients reporting feeling more comfortable on their feet throughout the day. Now here's the key word I want you to focus on: consistent. One session of ankle pumping will give you some benefit in that moment, but the real transformation happens when you make this a regular part of your daily routine. And because this exercise is so gentle, so accessible, and so completely without risk for the vast majority of older adults, there is no reason not to do it multiple times throughout the day. Here's what I recommend. Start your morning with 3 sets of 20 repetitions while you are still sitting on the edge of your bed. Do another set while you are sitting at the breakfast table. If you watch television in the evening, which most of us do, use those commercial breaks as your reminder. Every time a commercial comes on, start pumping. 3 sets during a single hour of television might add up to 60 or 90 additional repetitions without you even having to think about it. And if you find yourself sitting for long periods, whether in a car, at a doctor's waiting room, or at a dinner table, that is the perfect time to quietly do a few cycles. Nobody even needs to know you are doing it. I also want to address something that I hear from patients frequently, which is this idea that exercise after a certain age is somehow more dangerous than helpful. I understand where that fear comes from. Older bodies do require more care. Joints that have decades of wear and tear do need to be respected, but the research is overwhelmingly clear on this point. Gentle, consistent movement is far safer for older adults than prolonged inactivity. The risks of sitting still are far greater than the risks of gentle therapeutic movement. Poor circulation, blood clots, muscle weakness, joint stiffness, cognitive decline. These are all associated with sedentary behavior. And ankle pumping, specifically, carries essentially no risk for the average person over 70. If you have any specific medical conditions affecting your feet, ankles, or lower legs, please speak with your physician before beginning any new exercise routine. But for most people, this is as safe as breathing. I also want to take a moment to talk about the indirect benefits of improving your leg circulation, because they extend far beyond your legs. When blood is circulating efficiently through your lower extremities, your heart does not have to work as hard. That reduced cardiac workload is meaningful over time. Better circulation in your legs also means better delivery of nutrients and oxygen to the peripheral nerves, which can help reduce that tingling and numbness that so many people over 70 experience. Improved circulation supports wound healing, which is particularly important for anyone managing diabetes. And perhaps most surprisingly to some people, better leg circulation is associated with improved cognitive performance. The cardiovascular system is a whole body network, and when one part of it starts working better, the benefits ripple outward. There is also a psychological dimension to this that I find deeply meaningful. When patients discover that they have agency over their own health, when they realize that there is something concrete and effective that they can do every single day to take care of themselves, something changes in their relationship with their own body. Instead of feeling like a passive victim of aging, they become active participants in their own well-being, and that sense of empowerment has its own therapeutic value. People who feel capable of managing their health tend to be more consistent with their habits, more engaged with their medical care, and generally more optimistic about the future. And optimism, it turns out, is also good for your cardiovascular system. I want to close tonight by asking you to think about someone you love. Maybe it is a parent, maybe it is a spouse, maybe it is a dear friend who has been complaining about cold feet and swollen ankles and heavy legs for years, who has been told by one doctor after another that this is just part of getting older, that there is not much to be done. I want you to share what you learned tonight with that person. Tell them about ankle pumping, show them how to do it, encourage them to try it this week. Because here is what I know from years of working with patients. Small things done consistently change lives. The difference between someone who struggles through their 70s and 80s with pain and immobility and someone who remains active, independent, and vibrant well into old age is often not some dramatic medical intervention. It is often a collection of small, sustainable habits practiced faithfully over time. Ankle pumping is one of those habits. It is free, it is safe, it is backed by physiology and clinical observation. It takes less than 5 minutes several times a day. And it works. Not as a miracle cure for every circulatory condition that exists, but as a meaningful, measurable, daily contribution to the health of your veins, your arteries, your heart, and your quality of life. So tonight, before you go to bed, while you are sitting in your chair or resting on your couch, I want you to try it. Heels on the floor, toes up toward the ceiling. Hold. Then toes pointing gently down. Hold. Up, down, up, down. Do 20 of those and notice what you feel. You might notice a warmth beginning to spread through your lower legs. You might feel a slight tingling as circulation improves. You might simply feel more awake and alive from the knees down than you have felt in years. And tomorrow morning, do it again. And the day after that, because your legs have been carrying you through your entire life, and they deserve every bit of care and attention you can give them. Thank you for watching Dr. Mark Official. I'm Dr. Mark, and I hope this helped you take one more step toward better health and balance. Stay safe, stay active, and I'll see you in the next video.